I'm Dr. Rob Lindsay, and today in this video we're going to be talking about heart disease, and call this the Heart Disease Recovery Workshop. We're going to be talking a lot about some of the myths that are out there. We're going to talk about some of the truths that are out there, and so we're going to kind of motor through this and sit back, relax. I hope you enjoy, and I hope you learn something. First of all, just a little bit about myself. I have a master's degree in sports medicine, and I am a board-certified chiropractic physician. And I've had a lot of after-school extracurricular learning that I've been doing, trying to learn as much as I can about how to help people who have heart disease and other chronic health issues. And so I've been studying functional endocrinology, functional neurology, and functional blood chemistry analysis. A little bit different than your typical chiropractor, but the whole point being we want to be able to help people, and if I don't understand how to do that, then we're not going to be able to help anybody. I consult with a group of over 350 doctors in functional medicine around the country, so I love that because I have a great ability to reach out and ask for help from others that are doing the same types of things. We're part of Vallejo Health and Wellness Center, and where our vision here is to be the preferred choice for complementary and alternative health care. And then also our mission is that, working as a unified, God-centered and patient-centered team to define, provide, and measure one's individual progress toward wellness. Everybody's different and unique is what that means. There's no cookie cutter, there's no cookbook approach. The topics we're going to discuss here throughout this video are, number one, the cholesterol farce, or you might call it the cholesterol myth. We're going to talk about the mechanism that causes sleep, weight, and energy issues with people. We're going to talk about why that mechanism is largely ignored by your doctor. We're going to talk about what new lab tests are available to help you get to the root and get to the bottom of the cause of the heart disease. And we're going to talk about some specific foods that should be avoided and some foods that you should eat. The first thing is, can you handle the truth? And here's the truth. The truth is that cholesterol is not, I'll repeat, is not a primary risk factor for cardiovascular disease. This has been propagated for years and years and years. It's an outright myth. We might even say it's a lie. Elevated blood cholesterol is not a cause of heart attacks and strokes. Research shows that. Eating foods high in cholesterol, which we've been told don't do, is not a cause of increasing cholesterol. Eating high cholesterol foods is not a cause of heart attacks and strokes either. We've been told that, right? And in fact, high cholesterol and saturated fatty foods, actually keep serum cholesterol down and actually keep them in a normal level. This includes things like eggs and meat and fish and poultry, things that many of us over the years have been told, don't eat that, it's going to raise your cholesterol. The exact opposite is true. You have to eat these foods. They're critical for proper function in your body. And you say, well, what? What are you talking about? Half the people in the world, have been marching around with this whole cholesterol crusade for decades, saying cholesterol is the bad guy. Cholesterol is not the bad guy, and I'm going to show you that. Cholesterol and greed, this is the problem. So the almighty dollar goes first, Who cares about the truth and the safety and the efficacy of, one, the drugs that they give you, and two, what they're telling us. In the 60s, cholesterol was largely ignored until it was over 300, Then something happened in the 60s. Archer Daniels Midland Company, we've heard of them, They're a huge company. They deal with agriculture a lot. They wanted to sell a whole bunch of soybean oil. They were touting it as the new savior, So they led the charge against cholesterol and saturated fat. They started to say that cholesterol and saturated fat weren't good, and instead you needed to eat more soybean oil. They said, and they helped to further the problem by helping to have coconut oil and palm oils banned from import. We now know that coconut oil and palm oil are some of the most healthful oils in the world. They said that margarine, which is soybean oil, was going to save our country. It was going to save us from the epidemic of cardiovascular disease, right? And from eating things like these dreaded saturated fats, okay? The dreaded saturated fats like eggs, meat. But it was billions of dollars of propaganda was the problem. They swayed the minds and lifestyles of millions of Americans. But the medical pharmaceutical establishment, they at that point still continued to largely ignore the perceived cholesterol threat. They were ignoring it back then. Then something else happened. Statin drugs were invented. Lipitor, for example. This is a statin drug. So when this statin drug was developed and invented, very predictably a paradigm shift occurred, right, in the establishment that made these drugs. And they started to say, wow, we've got a drug that can lower cholesterol. We've got to get this on the market. Now, all of a sudden, cholesterol was the demon of the century, right? And our doctors and pharmacists were going to exorcise the evil, right out of all of our lives. And all the people that were taking and eating the ill-advised meats and eggs. I mean, it was just preposterous. The all-out war against cholesterol has been waged for over 25 years, probably more like 30 years. It's not waned, despite the fact that for at least 5 years, it's been known that cholesterol is not, and I'll repeat, and it never has been and never will be, a primary risk factor for cardiovascular disease. So you go in and get your blood cholesterol checked, they see that it's a little high by whatever they perceive to be their values. Now all of a sudden they're going to recommend you a statin drug. This is horrible for our health, folks. The dangers of statins: liver damage. Liver is your main organ of detoxification. You need it to be working right. Statins block something called HMG-CoA reductase. So now the liver just simply cannot make cholesterol. Well, that's a problem because, as we'll talk about in a minute, cholesterol is necessary for a whole host of functions in your body. It was put there for a reason. You need it. Without cholesterol, you would die. With taking a statin drug, you've got to check your liver enzymes every 6 months. Why? Because it causes liver damage. They know that, and yet they still give it to you. The truth is that your liver actually produces about 2,000 milligrams of cholesterol every day. And do you think that your liver is seriously trying to destroy you with cardiovascular disease? An organ that was put there for a reason and is necessary for life? Doesn't make sense. It's an essential nutrient with many critical functions, as I just stated. Statin drugs, they actually interfere with normal liver metabolism. They inhibit liver production of substances for health, and they damage your liver. Okay, have I ever said that enough? Your liver, it gets damaged. What else? They cause musculoskeletal pain that can be severe, and it's frequently misdiagnosed as fibromyalgia. That's another problem, because now, if you've been diagnosed with fibromyalgia, you're going to be given another drug, and then another drug, and another drug. It's often given in diagnosis of tendonitis or bursitis, like I said, rotator cuff syndrome, or fibromyalgia. And it often ends up having the person needing surgery, or so they think you need surgery, because, oh, my rotator cuff is really bad, doc. Well, we can surgically repair that, when in fact the problem was because of taking this drug, the statin drug. The muscle pain or myopathy can lead to death, tissue death of the muscle. It overloads the kidneys and leads to kidney failure and to death. Statin drugs can kill people. So you might be thinking twice about taking Lipitor. So are you still convinced that cholesterol is a bad thing? People with low serum cholesterol, less than 180, have 3 times the incidence of strokes as the general population. Huh. Sounds like maybe your cholesterol doesn't need to be that low. People with low cholesterol under 200, according to this study, suffer nearly 40% of all heart attacks. Okay, this comes from the director of the Framingham Heart Study, which was a huge study done with thousands of people over many, many years. Low cholesterol associated with 40% of heart attacks. Okay, so is the cholesterol actually preventing you from having a heart attack? I don't think so. The more saturated fat you eat, the less likely you are to suffer from a stroke. Where do you get saturated fat again? Meat, eggs, things like that. And we found that polyunsaturated fats, the ones they tell us are good for us, have no protective effect, but your risk of stroke decreases by 15% for every 3% of an increase in saturated fat. So that kind of tells me that maybe we need to eat more meat, more eggs, as long as you don't have allergies to those foods. That's going to increase your saturated fat, and according to this study, it's going to decrease your chance of getting a stroke. All right, does that sound like a good thing? I think that's a good thing. The number one risk factor for cardiovascular disease is this. It's the ratio of triglycerides to HDL cholesterol. That's what they call your good cholesterol. So if you take your triglyceride number and you divide it by your HDL, you'll get a number. So in other words, you want to have high HDL cholesterol, really up in the 70s, and low triglycerides, so that that ratio is smaller. Okay? Is that hard? Do you think that's a hard thing to swallow? Remember, you've been exposed to millions, probably billions of dollars of propaganda for anti-fat and anti-cholesterol. Okay? People are not healthier by eating less fat and less cholesterol, folks. They're not healthier. They're sicker. Let's go to talk a little bit about the lies of the seed oil industry. So things like margarine, mayonnaise, other cooking oils, salad dressings, anything from corn oil or soy oil, safflower, canola oil, peanut oil, or vegetable oils. Okay, those things are all bad. The good ones are going to be olive, coconut, and palm. But when you eat these bad ones, what it does is it actually accelerates aging. It affects your cells in a way that causes them to age faster. It creates breakdown, catabolic damage, breakdown throughout your body, and oxidative damage, oxidative stress in your blood vessels, and that is what leads to cardiovascular incident. The blood vessel walls are weakened, you develop scarring, you develop plaques, okay, largely due to eating those seed oils. In the Journal of Lipid Research from 2000, they said that eating vegetable oils from soy or margarine raised LDL, the bad cholesterol, and lowered HDL, the good one. Meanwhile, eating butter, things that are forbidden, right, because they're saturated with cholesterol, so to speak, actually lowered LDL and raised HDL, lowered the bad and raised the good. See, you would die without cholesterol. You would die. Why? Your brain is made of it. Okay, 5% of the dry weight of your brain is from cholesterol. Your nerves are made of cholesterol. Your body uses cholesterol to make all your important sex hormones and adrenal hormones. Without cholesterol to help your digestion, okay, you couldn't absorb any of your fat-soluble vitamins, like vitamin A and vitamin D, right? Vitamin D is everywhere in the news right now. You need that to live. Vitamin D is a hormone. You cannot absorb it if you don't have adequate cholesterol. Every single cell in your body is surrounded by a membrane that keeps all the parts inside, kind of like our skin keeps all our organs inside. Guess what? It's made of cholesterol. Without that cholesterol, that membrane, no cell in your body could survive. They wouldn't have any protective skin. Cholesterol is so important that your liver produces 2,000 milligrams of it every day. When following a low cholesterol diet, your liver makes up the difference, okay, by producing more cholesterol just to be sure you have enough. So even though you may cut down on the foods you eat that have cholesterol, or the good foods that have cholesterol, your liver's going to make up for the difference anyway. High cholesterol in the blood doesn't come from eating foods high in cholesterol. It comes from metabolism that's not efficient at handling the cholesterol you need. See, you have heart disease because you have another underlying health problem that nobody has found yet. You've not had a doctor who's looked into your neurology, that's looked at your liver, that's looked at your thyroid, your kidneys, all these other organs, the way we look at them. That's how people get sick, and that's how we get people better, because we dig. So what is one of the primary causes of heart attacks and strokes then? Well, it's triglycerides. Remember that, the other blood fat? That's the primary risk factor, is increasing your chance of having a heart attack or stroke. So, and even though triglycerides are a fat, the unhealthy diet that raises triglycerides has nothing to do with fat intake. Okay? Triglycerides and cholesterol as well are elevated by eating sugar. Your problem, one of your big problems with high triglycerides is because of the sugar that you're eating. One of the first things we look at on a blood lab is if triglycerides are elevated, then, and especially if they're elevated above your total cholesterol number, then that's a good indication that you have what's called insulin resistance. Insulin resistance is the next step to diabetes, folks. Okay? It's sugar. The other dietary factor that in some cases will raise cholesterol is polyunsaturated oils. Okay, the ones that say they're going to help you prevent cardiovascular disease? No, not so much. So neither triglycerides nor cholesterol are elevated by eating saturated fat or high cholesterol foods in particular. It's a lie, it's a myth. Please dispel it. Stop it. Learn how to eat right. Remember, while cholesterol is not a primary risk factor for cardiovascular disease, triglycerides are, as I said, and are probably the most significant. A study published in Circulation magazine in 1997 showed the results of a Harvard research indicating that the 25% of the population with the highest triglycerides to HDL ratio, okay, has a 16 times more heart-related incidence than the 25% whose ratios were the lowest. My goodness, folks, how many times do we have to say it? How many different times do we have to say that if your triglycerides are too high and your HDL is too low, your chance of having a cardiovascular disease event, a heart attack, a stroke, goes through the roof. Stop eating sugar. That's part of it. And as I've seen from countless other studies, high triglycerides come from excess starch, as I said, and sugars in the diet. So not just sugars, but starch. Remember, starch does some of the same things, like potatoes, for example. So, if it's triglycerides, not cholesterol, that is the true boogeyman here, right? What weapons do you have to defeat this villainous foe? Is it Lipitor? Is it Crestor? Is it some other statin drug? Absolutely not. You need to start with a fundamental diet, and you're going to be halfway there. So, what does that look like? 1, eliminate sweetened beverages, including juice. Even orange juice, it's just so full of natural sugars that it's going to cause a spike in your blood sugar. Along, you need to, I put here minimizing bread. I'd say some of you need to go so far as to eliminate bread, the grains that make bread. Cereal, pasta, not to mention, of course, cakes, cookies, right, pie and ice cream. And you're going to see a significant improvement in a period of time with your high triglycerides. So, the 4 dietary rules, right, to beat heart disease. Number 1, or they're all in order here. Number 1, eat 3 meals a day, right? Each needs to include some serving of meat, fish, poultry, perhaps eggs or cheese, and you must eat breakfast. These are proteins. These are your saturated fats, folks. You need this. You need to limit your intake of sugar, including fruit. You need to strictly avoid juice and other sweetened beverages. You need to strictly avoid these polyunsaturated oils, which is your anything that's in a salad dressing, apart from like olive oil. Okay, mayonnaise, margarine, foods containing vegetable oils or cooked in vegetable oils. Stick with olive oil and coconut and palm oil. So what causes heart attacks and strokes? Well, it's not cholesterol, right? Considering heart disease will claim the life of 1 out of every 2 people, it's about time you learn the real cause of heart attacks and strokes. Number 1, high triglycerides. We've talked about that. Number 2, low HDL cholesterol. Low HDL, the good stuff. Dietary deficiency of saturated fats and cholesterol. Remember, low intake of saturated fat is a factor in increasing your risk of heart disease. Excess polyunsaturated fats, as we talked about, those types of oils, vegetable oils, corn oil, sunflower and safflower oil, right? Excess dietary carbohydrates, particularly fructose sugar. Fructose sugar is in almost anything that's packaged, folks. If it's in a box, even if it says gluten-free, that does not mean healthy. It's full of bad stuff for you. You have to think about changing your diet to shopping on the outside of the store, where the vegetables, the fruits, the meats are. That's where your diet needs to be. Some of the other causes, if your thyroid is insufficient, if you've got hypothyroidism, that leads to cardiovascular disease. Too much estrogen. Some of you women have accumulated estrogen, and it's accumulating in your liver and in your other tissues because you're taking hormone replacement, you're taking birth control pills, or just your hormones are out of balance. Or, in men especially, but in women too, testosterone that's too low. So you need a certain amount of testosterone. Some other things. Excess, what are called catecholamines. They're called epinephrine, norepinephrine, and dopamine. Okay, these are stress hormones. These are stress hormones. They come from your adrenal glands. Studies have found that the increased secretion of stress hormones when someone is angry, right, can damage the endothelial cells, those are the cells that line the blood vessels, and the arteries, and accelerate the development of atherosclerosis, that's hardening of the arteries. This is what is ultimately responsible for most heart attacks. So what it really comes down to is damaging those endothelial cells that line your arteries is the culprit. Your body tries to repair it, and it builds a plaque, and it shuts off or occludes the blood flow, and you get a heart attack. They're also associated with platelet adhesions. They get sticky, right? Platelets normally assist in healthy blood clotting, and they also contain, they can stick to sites of damage and lead to blockages, right? That's what builds up plaques. Excess cortisol, the hormone from your adrenal glands. Excess insulin. What this does is it's responsible for atherosclerotic lesions, okay? These hardening of the arteries. Excess insulin has also been responsible for vasoconstriction with blood clotting, okay? So these are all problems that you need to look into, folks. What about oxidative stress to the heart and arteries? What is oxidative stress? If you take a bite out of an apple and leave it on the counter, it's going to turn brown. That's called oxidation. That apple has oxidized. Well, when that happens with butter, and butter turns rancid. When it happens with iron, it rusts, okay? These are all signs of oxidative stress, and the same thing can happen in your arteries. A single free radical, right, can set off a chain reaction that can destroy an enzyme, can destroy a strand of DNA, or an entire cell. Ongoing free radical damage leads to destruction of the organ tissues, of artery walls, of veins, and maybe a contributing factor in the production of cancer cells. Do you think it's a good idea to keep your antioxidant level high? Yes. You've got to keep your stress low. Excess vasoconstriction, that means that the blood vessels get smaller, all right? This increases the risk of blockage by reducing the diameter of the vessel, okay? Hypertension or high blood pressure is a good indicator of vasoconstriction. If you have high blood pressure, your arteries are already closing down, and that can contribute to a heart problem, a heart disease, heart attack, stroke. Magnesium deficiency. Magnesium is necessary for the heart to be able to pump and contract the way it's supposed to. Too much calcium, right? It pushes magnesium out of the cell where you need it. And in the heart, blood vessels, and vasomotor nerves, where you need magnesium, it's going to push it out. So too much calcium. If you've got a mineral deficiency, okay, some of these trace minerals, that can lead to a cardiovascular event. So it's an exhaustive list, right? Where do you start? What are you going to do? Well, let's look at some clinical indicators of cardiovascular disease. Okay, some things to look for. Okay, arrhythmia, elevated triglycerides, elevated homocysteine. You'll find this on a lab. If it's above 7, you've got inflammation in your arteries. Elevated insulin. Remember, insulin is what takes sugar and escorts it from the bloodstream into the cells. If you've got dips, spikes and dips in blood sugar control, the same thing's going to happen with insulin. Hyperinsulinemia with normal blood glucose is a factor associated with hyperlipidemias, too much fat in the blood, and an independent risk factor for heart disease. Elevated cortisol levels. Cortisol is your stress hormone. See, patients with heart disease exhibit higher cortisol levels than do control groups. Elevated estrogen in relation to progesterone, too much estrogen. Low testosterone in men. Higher levels of testosterone have been found to offer men greater than 5-fold protection against coronary artery disease. So if you've got low testosterone, low sexual drive, low libido, okay, you've got an increased a chance of having a heart problem. High testosterone in women is not good. All right. Elevated C-Reactive protein. You'll find this on a blood lab. If it's above 3, it's too high. That's another indication of cardiovascular inflammation. Mineral deficiencies, fatty acid imbalances. Fatty acids come from fish oils, for example, EPA and DHA. If you don't have a balanced fatty acids, which are good things, then it's gonna it can affect your heart. That's why people say, hey, take a fish oil supplement. That's going to help your heart. Thyroid function. You've got to find out what your thyroid is doing. So, do you see the significance of these two lists right now that we've just gone through? One, the risk factors, and two, what some of the problems are. So the knowledge you have in the first list puts you far above the vast majority of people in the U.S., okay, in understanding cardiovascular disease. As unbelievable as it may seem, we have a condition that kills more than 50% of our population, yet most doctors are almost entirely ignorant of the causes of this condition. Is that absurd or what? And so instead, you leave their office with a statin drug, a high blood pressure medicine, and maybe something else, and if that doesn't seem to work, they're going to give you an antidepressant, which is sad, when instead they need to look to the cause. What is the underlying cause of this? The real beauty is in the second list, see, because here you have the best clinical indicators that are out there that inform you completely about the 19 causative factors of cardiovascular disease. Do you see how valuable this is to you and your loved ones? All right, do you see that? Why would you not get this checked? You have the ability to define and monitor the 19 causes of cardiovascular disease with best clinical indicators. So, has this just been good information, or is this something that you want to put into action? Okay? If the information that we presented today makes sense, then you've got to do something, folks. You've got to take some action here. What you need to do is you need to set an appointment here in our office. If you want to find out more about how to get help for this issue, all right? Normally our consultation and our neurologic assessment is $200. But if you reserve a spot, it says tonight, but if you reserve a spot by calling into our office, okay, and if you mention this video, all right, you'll find that we'll do that visit for free, okay? You'll have to have all your paperwork filled out before you come to this office because I want to be on time. You'll need to bring a t-shirt and shorts with you, okay, so when we do our neurologic exam, you can be ready for it. When you come in, you're going to have to set a second appointment called the Report of Findings, where we'll go over everything that we found. You must bring your spouse. So are you ready? That's the question. You ready to change your life? And that's my goal, to change your life. If you're ready, I can help you. You can call 952-949-0676 at Vallejo Health and Wellness Center. We can help you get on the road to recovery. Thank you for watching this video. Hope you have a blessed day.